okay? So this is where we're going from here. The next step will be our lab practical. And the next step for doing a heart cath would be to complete the setup of the tray. So we did a basic setup, okay? Without the manifold. That's pretty much all that we really still needed. Now, we're not gonna get to the manifold today. I've got it on here, and I'm gonna put it over here just to kind of show you where you would be placing it. But actually talking about it, working it, and learning how to prep it, we'll do that next week because we got a lot more to go. I'm trying to show you in the first hour and then have some practice time for the second hour so we can go ahead and put it to work what we're learning today, okay? For practical purposes, for time's sake, you're not gonna have to come back in and reopen the tray, pass off items, fill your syringes, label, that's all gonna be ready for you. You are gonna have to come in, open your gown, gloves, of course get your hat mask, gown, gloves, get scrubbed in, get your lead on, scrubbed in, scrub, gown and glove in 8 minutes, okay? So it's gonna be timed at that point, all right? Then you're gonna come to your tray and then everything will be here for you. I am still gonna have you flush your catheters, flush your wire, and reflush your sheath because this is one of the things that a lot of people struggled. So far, everybody's done pretty well with it. But if you don't keep doing it, this little stopcock right here just throws people off. So I still want us to continue with it. I'm still gonna make you prep that. So just a reminder, when you do prep, we're gonna go in. One thing I didn't talk about before was if there's a little cap on, I like to take that little cap off. That way that if I did need to connect something to this port, it would already just be off, okay? Remember, you're gonna open your stopcock, quarter turn. You're gonna flush. Yeah, I think that one. If you'll put that one on that tray over there, I think that is. Yep, that's it. It just seems a little easier to fold up, a little quicker. Turn your stopcock back off. Flush your dilator and put it together. Okay. All right. So now this part that we're going to practice today, and we may only practice this today for time's sake again, because I don't have enough drapes for 19 people to test with. You'll see, once we do practice, when we have to start folding them back up, it just takes a lot of time. So we're gonna practice with it, but I'm not gonna test you on it. Same thing that I did with passing off the catheters, passing off the flush. We practiced it, but I didn't actually test you on it. You're gonna be doing it if you go cath, more routine. And so what I'm really doing is trying to just give you the concept of how you should drape the patient. And then for the practical, your patient will already be draped. Now you'll have to set everything up, which I'm gonna go through the setup today as well, but we're not gonna do the draping. So that's the thing. Once we get, probably like I said, we might drape, just practice draping one more time next week. Then I'm just gonna leave the drapes on the patient and then you'll just practice your setup and everything else, okay? So that being said, different ways we can prep, I already talked about. So the circulator may come in and clean the site with the cleaning solution. Or it may be that the scrub tech cleans the site with the cleaning solution, okay? Just remember that if they have not cleaned the site, you cannot go and touch it because your hands are sterile, it is not cleaned, okay? If I am the one that's going to be cleaning, there's a couple different things that we may do. Just say that that white sheet was too close over into my field. Some people might take a towel and lay it down, a sterile towel. Now I did make a mistake there. So if I've gone out here with this sterile towel, I can't bring it back in here because I've already contaminated that. So you do want to be careful. You can always come over here and then move backwards but once you've gone out of the sterile, you can't come back in. Now technically, I haven't washed this yet, but because I'm trying to keep that towel sterile, once I hit that sheet with it, it's not sterile anymore, okay? Some people, you wanna...
Hold it back?
Yeah.
Yeah.
So some people, or some places, especially like if they're prepping both groins, they might have had the sheet across the top, the sheet across the bottom. Go ahead and set it up in that way. We'll pretend there's a sheet across the top. Go ahead and put a little, so we would have had them covered with something that wasn't sterile or wasn't clean at that point. Now it's about time to go ahead and start cleaning. What some people will do is the scrub tech will get a towel, a sterile towel, and you'll come over, they'll pull away that one, and then you'll just kind of drop that over them to cover them. A couple different ways it might be done, okay? Now I can touch the top. Now do you see how I dropped it? The thing is, you always got to keep your hands as far away from something that's not sterile as possible. So I couldn't have done like this and laid it down like we might in our normal world when we're not sterile, because I just contaminated my glove. Okay, so very specific. You're going to make sure you always protect your hands. Just kind of drop it. Okay? Now if I did want to move it because the top is still sterile, I can move it over a little bit. I have, oh! Who colored this for me? You didn't color this for me, did you?
No.
It's backwards.
I thought it was backwards.
It is. Can you come and just wipe it off and then...
Sorry, did I take that?
The markers are right over there. So, artery and vein. Your artery, remember, is always on the outside and the vein is on the inside. I've got this here for us for a visualization for now. On the other mannequins, they have an arterial site already. That's going to be your arterial site there. And on that one, there's not a venous site. But this gives you the visualization of how the artery and the vein is going to lie there. The thing about, remember when I talked about shaving and prepping, even if we're only accessing the artery for a left heart cath, we always want to make sure we still have availability of accessing the vein. We'll understand that more a little bit later. I'll get into that more deeper. Of course, if we're doing a right heart, then we've got to be farther over so we can get access to the vein. Ooh, I didn't tell the first group, so I worked on Friday. This guy who has been in the field for a really, really long time, he prepped the patient, and I should have said something, but I don't work with him a lot. And I was like, oh, maybe it'll be okay. He did not shave well at all. Mm-hmm. And it was a right and left. And for some reason, most of the time, the artery and the vein is right close to each other. This person's vein and artery were about that far apart. The doctor had to go way over into the pubic hair and access the vein. And he was not happy. I took the blame because I was the scrub tech. I should have, see, he had already cleaned it. I was like, dang, maybe I can make this work. I don't want to, you know, be that person, which I've done it before. I don't know why I was worried about being that person. You know, I've said before, hey, this isn't shaved good. You got to re-prep it. But obviously, if you've cleaned it and there's still too much hair in the field, you got to get it out, you got to shave it, and then you got to re-prep it again. So anyway. That being said, I always err on the side of going too far over rather than not enough when I'm shaving the patient, okay? All right, if it has been prepped already, it has already been cleaned by the circulator, then I can come and I can feel for the artery, and that's what I'm doing. I'm feeling for the pulsation. Remember, you cannot really see it. It's under the skin, okay? So I'm coming to feel for the artery, all right? If it hasn't been prepped, of course I can't touch that, all right? That's when I'm gonna come over with my little prep stick, break it, I'm gonna hold it as far back as possible, and I'm gonna clean, 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 clean. 2-minute scrub, 2 inches from the site. garbage. Does not go back on my tray, okay? Because it's considered contaminated. Even though the cleaning solution probably has killed all the germs, we consider it, we throw it in the garbage, okay? I'm gonna let that dry just a little bit, and now I'm gonna get ready to drape my patient. There's multiple different drapes. In fact, oh lordy, so that one didn't get folded up very good.
No, it did not.
Okay, take that one off and
Okay,
put
find
that
another one?
put that other one that we had over here. Unless you can find,
There was another one.
there's another one like
Yes.
this? Okay, grab another one like that. So different kinds of drapes, depending on, what that hospital likes. This is a basic one, because it's easy to fold up. Some of the drapes have arm for radial. This one doesn't. This is strictly a femoral drape. So it's only got right and left femoral access. A lot of the newer drapes that people are using, like I said, they actually have radial, brachial, both right and left arms, and both femoral access. And when I say meaning access, that means that when I take this paper off, there's an opening and sticky tape. This is called the fenestration. Okay? To orient myself, it's a lot like your gown. So when you pick it up, there's going to be a solid side and then there's going to be an open side. It's almost just like if you were putting your gown on your body. That's how you want to orient it on the patient. So the solid side is going to go up against the patient. That way this can open up and we can open it over the whole patient. They're also going to have on the fenestrations an orientation of which side is the head, because that does matter. The head piece is shorter than the foot piece. It's very long, hangs off this end of the table. Okay? Also, some of them will tell you if it's the right or left side. This one does not. But if I know that this is the part that goes against the body, okay, and actually, I couldn't mess that up because this is showing me that the feet, so I should know that's wrong. I need this towards the head, so I've got to turn it this way. So that's going to make it where this is going to be my right groin, this is going to be my left groin. Okay? I'm not going to remove the paper if I'm not prepping that groin though. I'm going to leave that paper on. So for here, this is going to be right groin only. Okay? So I'm just going to take this off. We would normally throw it in the garbage. Okay? And then I'm going to come over and again try to orient where I think the doctor is going to be getting access at. I'm going to hold it together and I'm going to kind of hover over and try to eyeball where I think I'm going to lay this opening down. Okay? I can do a little adjustment and then I want to just bring it down and kind of push it to start kind of sticking to the patient. All right, at this point, then I'm going to just flip over and let that fall over. Kind of similar to when I open my tray and I flip that one side over and I flip that one side over. Okay? Now, we're going to drape towards the head first, and that's the only way we really can. And then we're going to drape towards the foot. When you're scrubbed, you want to always be able to see in front of you where you're going so you can keep yourself sterile, okay? So I don't want to grab and be walking backwards because I might hit my arm on the image intensifier or something, okay? So I want to always be going forward, being able to see what's in front of me. I don't want to be walking backwards. Another thing is, as I mentioned with laying that towel down, you don't want your hand up underneath, even this way, because now you're running your sterile fingers across the patient's chest that's not sterile, and you could contaminate your hands. So again, this is one of those little details. Pay close attention to. So you want to pick it up back here. So you're protecting your hands, and then you're just going to walk it up and just just drop it. This is going over the patient's face a little bit. Some of them really go over the patient's face. And so I'll just tell Mr. Jones, this is gonna go over your face for a minute, but we'll get it off. All right, the circulator, the nurse can help. And so if you are the circulator or nurse, this is important as well. So watch, she's gonna tuck it. When you tuck it to get it off, you always tuck it under. I want you to tuck it over so I can show them what not to do. So you don't flip it that way because what did I just do?
Contaminated.
Yeah, because that being here, touching the patient, is now contaminated. So now I just put contaminated back into closer to my sterile field. Okay, so you can do it the right way. And so you can do a little tuck under to get it off of their face. Okay? Now, I'm going to do the feet. Same thing. I don't want to be walking backward, not knowing what I'm going into. Even though the back of me is not sterile, I know that. And you might say, yeah, the back of you is not sterile. You still want to always be going forward. Same thing, I don't want to grab under here so that I'm possibly dragging my hands over something that's not sterile. I'm going to lift up. Go ahead and put that pole close. Now this is a little trick you just got to get used to in the lab. So that pole is going to be connected to the bed, okay, because it moves with the table. So you're going to pick up and you're going to kind of flip and you're going to kind of drag it this way and then let it drop, okay? That way I can bring this up and make myself a little barrier on that side with my clips. And I'll show you that in just a minute, okay? And I'm going to come back and I'm going to take the paper off and I'm just going to make sure that I'm good. You've done a 2-inch, so you have a little wiggle room, So if you don't have it good on there, and this is why I do like to use that sterile towel if I can, because you can touch the top of that sterile towel and make a little bit of adjustments, but you do want to try, and these are going to stop sticking pretty soon because him being cloth, you know, and we're reusing it. But you do want to get that sealed down nicely onto the patient's body, onto their skin, okay? And again, we want to try to have had made enough room where I can get arterial access and I can get venous access, even if I don't need it. There could be a time where you have to throw an IV in, you have to throw a temporary pacemaker in, and that's going to be in venous, okay? Like I said, we'll get into that in more detail later. So now I can do my clips. Now you're going to see people do this different. Actually, I'm going to do towels and clips kind of at the same time.